Tight hips. Does that sound like you? It's a really common problem we see every day in our office. With everybody nowadays sitting on phones and computers, electronics, driving all over the place, our hips can get really, really tight. And that can lead to a host of many other problems. We know some of the biggest causes of lower back pain are tightness in our hips and our hamstrings. We know our sciatic nerve runs through our hips, so if there's tightness in there, that can give us that pain down our leg, sciatica, numbness, tingling, dysfunction there as well. It can lead to a whole host of other problems and can really start to limit your mobility. The goal of this video today is to give you the best exercise that I've found that you can do at home to stretch your hips out, keep them loose and mobile, and keep you active and functioning at your best. Hi, my name is Dr. Scott McCrimmon. I'm with Caledon East Family Chiropractic. And our channel here is dedicated to giving you the latest information from all our practitioners on what you can do to keep yourself healthy. So today we're going to go through a few different exercises, and I always say with any exercise, you should always check with your healthcare practitioner first to make sure these are right for you, but these are some of the best ones I've found that are simple and easy to do at home. Always remember, if they create pain or discomfort for you, please stop and again check with your healthcare practitioner. So I'm going to show you some different stretches you can do, and I'm going to show them in different positions. I'm going to start with some laying down, some sitting, and also one that you can do while standing up that we find really effective. So where I'm going to start is laying down. Often when people first wake up in the morning, their hips can be really stiff and tight, depending on the previous day's activities, or a lot of times muscles and joints will stiffen up a little bit overnight. So these are some stretches that I show patients to get them going in the morning. So when you wake up, we always try and get patients just for a couple minutes to lay on their back. And what we have them do is take their knee and pull it to the shoulder on the same side. You're going to hold that for about 20 or 30 seconds. Then after you've done that, you're going to take the same knee and you're going to pull it towards the shoulder on the opposite side. That will give you a bit of a deeper stretch in your hip. Again, other side, so 30 seconds same side shoulder, 30 seconds shoulder on the opposite side. Okay. If you have trouble reaching up to your knee, whether it's knee mobility, hip mobility, or just not flexible where you can do this, you can keep a towel beside your bed, and if you throw it behind your knee like this, it makes it really easy just to pull your knee up here and pull your knee across, and you don't need the same range of motion through your knees or your joints to be able to do that. The last stretch I'm going to show you that people often like to do, a little bit more complicated, maybe tough for some people, is if you cross your ankle over your knee like this, and you reach behind, either with your hands or with the towel, the opposite knee, and you pull that up towards your shoulder, that will give you a very deep stretch in your hip. Get a little tougher to do for some people, so we cross our leg over, reach behind our knee, pull up like that, but that will give you a really deep stretch in your hip, and really great to get things moving in the morning. Okay, so the next stretch I want to show you for this upper hip is to be done while you're sitting. This is one I show people all day long because it's really easy to do sitting at your desk, whether it be at home or at work. You can do it in the car, you can do it sitting in the stands, watching your kids' sports, whatever the case may be. So we find this, a comfortable spot to sit, your chair, bench, whatnot, and I like to slide a little bit forward so you're a little closer to the edge. What you're going to do is you're going to take one leg up like this, with your foot, your ankle resting by your knee. Now you'll see a lot of people teach where they put the ankle here and they'll push the knee down and lean forward. I don't mind that stretch, but I find for a lot of people it doesn't get deep into the hip. So what I do is actually go the opposite way. Ankle just on the outside of our knee, grab your knee and again pull it towards your opposite shoulder. So just pulling up in this direction as far as you can comfortably go until you feel a nice stretch in your hip. Once you're holding that and you feel that stretch, you're going to take your knee with the foot that's on the floor and you're going to push it the same direction as your foot. So I'm going to push that across. So as I pull up, I'm pushing that knee across, and that will get really deep into your hip. So I'll show you with the other leg. We put our ankle on the outside of our knee, pull our knee towards our opposite shoulder. Now push the bottom knee the same direction as the foot, and that's going to get it. This is my favorite hip stretch of all time. It gets really deep in there, easy to do anywhere, and it really starts to loosen our hip up. Okay, again, I don't mind adding this one as well, just to move the hip in the opposite direction, but to get deep into our hip, this is my favorite one. Okay, so the last stretch that I want to show you for hip mobility is a standing exercise that you can do. It requires a little bit more mobility, a little bit more flexibility, so use this with caution, but if you're able to do it, I find it a really good stretch. So what you're going to do is you're going to stand at the edge of whether it be a bed or a couch or any structure that you feel that you can comfortably get your leg up on. And what you're going to do is you're going to take your leg, you want to keep your chest up, your lower leg is going to come straight across your body with your knee bent. From here, you can move in different directions. So a lot of times I'll do all three directions to stretch it out. So I'll start by going over my knee and just leaning forward, okay? That gives me a nice stretch through my hip. I'll feel a little bit of a pull into my lower back as well. Another reason why I love this stretch. You can also go forward and lean straight down over your hip. Again, making sure it doesn't create any pain or discomfort in your lower back. I find that gives a little bit more of a stretch through my hip and my back. And then for the deeper stretch, I move away from my knee and come right across like this. And that gives, I love this stretch, gives me a really deep pull right in through my glutes, right in through my lower back, and also is giving some extra rotation through my hip, which is a good thing as well. So it's just like a pigeon pose you would see for those who have done yoga. Again, we do all three sides. We come here, we can go middle, and we can go across, okay? Great stretch, really helpful. Again, just make sure it's within your comfort zone, because if you have trouble with your knee or your hip, that might be a little more challenging. So with any of these stretches, we want to aim for about 30 seconds of a hold. So get in the position, hold it for, I usually say 20 to 30 seconds. 30 is a little bit better if we can get there. Always within your comfort level. Anytime you're doing a stretch, there's a difference between I can feel a nice strong pull or a nice deep stretch versus pain. If you're getting into the painful range, make sure you back off. We don't want to create any injuries with these, but a good deep stretch is fine. Okay, listen to your body. Your body's always going to tell you what to do. So those are some of my favorite hip exercises. As always, there's tons more depending on your condition and what's going on with you and your body. But I certainly hope you found this helpful. Please explore the other videos on our channel from all our different practitioners. We have videos from both our chiropractors, from our osteopath, and from our registered holistic nutritionists that are going to give you information to help keep you healthy. So if you like what you saw, click the like button, click on the notification bell, and please subscribe to our channel, and we'll keep you and your family, we'll give you the best tips to keep you guys all healthy. Until next time, have a great day.